What I thought I'd do today is give you a bit of an update on what's going on as far as the COVID war. We're nearing the end of March, and I'm extremely excited that we have had a great penetration of offering the vaccines to the population, particularly here in St. Mary Parish. Just to give you some up-to-date statistics, as of today, and today is March the 29th, we have completed Teche Action Clinic over 5,196 to be specific, of vaccinations to our patients, primarily in Franklin, but in general, St. Mary Parish and a few of our other sites in Houma, Dulac, Thibodeau, Edgard, and Reserve. The statistics that, and those vaccines have included the Pfizer vaccine, Moderna, and just last week we received 600 Johnson & Johnson, the one and done vaccine, and we've given out all of those. So we are extremely pleased that we were able to work our way down a priority list that the governor and the president had set out, starting off with the population of 70 and older, then working our way down. To date, we have vaccinated over the 5,100 over the 5,100 that we've done. 40% of those have been African Americans, and we're very pleased with that group because that was the targeted group. In addition to ourselves in St. Mary Parish Franklin Foundation Hospital, I spoke with the CEO, and she has indicated to me that they've vaccinated over 4,700 folks. So I think we should be applauded because of a community of Franklin of just 7,000. Between the two groups, we've done over 10,000 vaccinations. So, and I think that's really a great effort. I can't thank enough President Biden for his leadership and Governor John Bel Edwards for his leadership. As you may know, and I want the public to know, now Governor Edwards has opened up vaccinations so everyone in the state who's 18 and above, 16 and above for Pfizer, but everyone in the state can now get the vaccine. So I think we've done a really good first wave effort of getting those most vulnerable people following the guidelines and priority group. Now we're focusing on those people who had some hesitancy. And let me just say a word about hesitancy. It was normal for everyone to be hesitant in the beginning because there was so much misinformation and mistrust. The medical community and healthcare workers, a lot of them had doubt until we saw the science, we saw the studies, we looked at the clinical trials when the FDA and CDC evaluated the vaccines, and we came out with the 95% effective rate, 100% against death. Then all of us who believed in the science got on board. And I'm saying all of us, the leaders in the community. If you recall, when it came out, we wanted to practice what we preach and lead by example. So I know I took it, I had my picture taken. The mayor of Franklin took it, the head of Community Action Agency, Ms. Franklin, the head of the Council on Aging, Ms. Beverly DiMaggio, Mayor Rodney Grogan, all the leaders and religious leaders in the community also took the vaccine to demonstrate to the people that it was safe. So as we move into the next phase of trying to get herd immunity and get our vaccination rates up, I can't stress enough the safety. We now have over 130 million people, I think, have gotten one dose. And the reports of any side effects have been just minimal, with local site injection pain, some rash. Some people have had some aches and maybe a little fever, no longer than 48 hours in response to just Tylenol. So the safety is something that should not be an issue. And if we're ever going to get some normalcy, we're going to have to vaccinate more and more people. At the same time, if people would just be a little patient. I love the football metaphor of not spiking a ball at the 20-yard line. If we would continue to vaccinate, continue to wear masks, continue to socially distance and not have super spreader events, I'm confident by the end of the summer we can get to a very good place. And by the fall, we can get back to some normalcy.